Good evening. As you can see, we're both just coming back from work, but this video needs to be made ASAP. We have a duty to our fellow Nigerians to interpret this result that's just entered the chat. If you follow what has been happening, Blessing CEO came out, announced that she has stage 4 cancer. Following a lot of backlash, it became obvious that she doesn't have stage 4 cancer. Now, does she have cancer at all? We still couldn't prove that. And a lady came and claimed that she doctored her result and presented. The doctor that signed her result could not confirm it. It became obvious that she wasn't telling the entire truth. She disappeared, came back online, apologized. But what did she apologize for? For the drama. She never said she lied. She didn't apologize for lying, which means she's still claiming that she does have cancer. And she was promising that she's going to carry everybody along. Soon after, we saw her entering a CT scan. Let me clarify something, because I saw a lot of comments saying that she's an MRI. MRI is not an MRI. It is a CT scan. So yes, if she wore earrings or wore nose ring, that's okay. That's not the problem. And she proceeded to post the result. I wasn't into the story anymore, but when I saw that result and she now told doctors, over to you, I think she said something to the effect of doctors in the house, help to interpret. I got triggered again. It was a call I must answer. I looked at the result. From my own understanding, from what I know, there's no stage 4 anywhere. Now, I'm not an oncologist, but I like to be accurate. I believe in accuracy. So I have invited a breast cancer surgeon, Dr. Orji. She has performed many breast cancer surgeries. She has removed breast. She has put in breast. She has done it all. So she is here. Yes, when they remove the breast, sometimes they construct. But anyway, yes. So she's here. So nobody can say, oh, Dr. Precious, you don't know what you're talking about. She is going to interpret this result for us, because that's what she does. We are here to ask her questions, and she's going to interpret it. So, Dr. Orji, over to you. You have seen the result of Blessing CEO CT scan. Does Blessing CEO have stage 4?
Hello, everyone. Well, the simple answer to that is no. A stage 4 means that you have metastatic cancer, meaning it's the distant metastasis. And if we're talking about breast cancer, it means it's gone from the breast past the regional lymph node and has gone to a distant organ. Organs like the brain, the abdomen, like the liver, or it's gone to the bone distantly. And that's why if someone has an advanced cancer, and we're doing a metastatic workup, we would then look for those things by doing a chest x-ray or a CT of the chest, abdomen, and pelvis. In her case, she is now having a CT of the chest, abdomen, and pelvis from what I saw that was posted. But I am curious because I thought you said she had stage 4 cancer since March or February. So why are we just getting to a CT scan in April? But either way, let's look at the CT scan. The CT scan actually says that there is no evidence of metastasis. And I can clearly, at the conclusion at the bottom is where the layman can just read that conclusion and see what that is. However, it's cut off a little bit, at least on the CT abdomen and pelvis. It's almost slightly cut off. But however, if you go to the main body of the CT, you can find what you need.
Dr. Orji, let me explain a little bit. Dr. Orji is using a lot of big grammar. Dr. Orji, if you can try to bring it down a notch. My channel thrives on talking as if I'm talking to elementary school. So because we want to make sure everybody understands, especially the Nigerians that like to contribute money. We want them to understand. So they'll make sure they're contributing to a course they understand. Blessing have asked that we interpret this result. We are actually obliging her. This is her request. Now, what Dr. Orji just said, Dr. Orji basically said from the result, it shows that there is no cancer going anywhere.
Because if this is all going on and this is all fake, we might want to check our brain. On the CT of the abdomen and pelvis, it says clearly here, the liver is normal in control. No issues. That means there is no evidence of metastasis in the liver. It says the spleen is normal. It says the bowels are fine, that's the intestine. The only positive thing on this CT really is something that has nothing to do with breast cancer or any cancer, but it actually points almost to the second to the last paragraph on the CT abdomen and pelvis. And it says there is extensive subcutaneous fat stranding involving the lower anterior abdominal wall, pelvis, and extending into the upper thigh. So essentially from the belly button down, going down to the upper thigh, there is fat stranding and subcutaneous emphysema, which can only come with somebody having a severe infection that is just all over that area, or somebody that has just had a recent subcutaneous surgery, such as a liposuction, a BBL, or something, 360, some reconstructive cosmetic type subcutaneous surgery. And that's what that is saying. And if you look at this, it even tells you on the CT, it says this could be post-operative. And it says that on the CT. So this could be post-operative subcutaneous emphysema with inflammatory changes. If there is a history of surgery, please correlate clinically. Now, another thing that I see on the CT report is that usually at the beginning of the report, and you can see it will ask you for clinical summary. Because whenever we send in somebody to go get any kind of imaging, we'll give the radiologist a clinical summary. There's a mass, or patient with fever, or patient status post recent surgery that we're concerned about something. We usually...
In other words, why are we doing this CT scan, correct?
Exactly. But in this case, it actually says not provided. So if this CT was being done because of a patient with cancer that we're working up for metastatic cancer, it would have said patient with a history of right breast cancer for workup. And that will be very clear to the radiologist that is reading this report that this patient has a history of cancer. We're looking for metastasis. But that was not provided there. And it says clearly clinical correlation essentially advised. So nothing was provided. So based on the CT abdomen and pelvis, there is no evidence of intra-abdominal or intrapelvic metastasis. And then if you go to the CT chest, the second paper, the last one for the CT chest, it's a little bit more clear on the last page, where if you look at the conclusion at the bottom, without even reading the inside, it says no CT evidence of intrathoracic metastatic disease or primary pulmonary pathology. And it does say in the CT of the chest, because the chest will show you the breast, it says right breast changes, features are indeterminate on CT. So quite where I'm like, hold on. So the right breast changes is indeterminate. So when things are indeterminate, it means we can't tell you what's going on. But it did say in the reading that there is no discrete mass, but it's indeterminate. That means there's some changes. Changes could be subcutaneous. If somebody had a recent abscess, recent surgery, you could also see changes. So it says that. And then on the recommendation, it says targeted breast ultrasound is recommended. And then it says consider diagnostic mammography for further characterization depending on the ultrasound findings. The biopsy is to say, tell us, is this cancer or is this just a benign lump? Because we have benign lumps. Now, if it is cancer, then immediately, especially depending on what the exam showed, if the exam showed a huge mass, and you ought to check the patient's axilla as well. The axillary area will tell you about the lymph node status. So if clinically you palpate a huge enlarged lymph node, that tells you this is an advanced tumor. And so once you confirm that the tumor is malignant, meaning it's cancer, you start the workup. Then you do a CT abdomen and pelvis to rule out metastasis, because that would then tell you that the patient is stage 4. You cannot diagnose a stage 4 without an imaging. Yes. All you can say is even if the axilla is full of lymph nodes that are clearly probably from the cancer and the mass is huge, you will call them a locally advanced cancer. And then once you do the workup that shows maybe it's in the bone somewhere, or it's in the liver, or it's in the brain, then that is officially a stage 4 metastatic cancer. So it's a little odd that she first said she has a stage 4 cancer. There is no biopsy. There is no pathology report. So when you do a biopsy, the whole point of it is that they take a tissue, right? And they send that to pathology, who looks at it under a microscope, does different testing on the tissue. If the tissue is positive for cancer, then you do different testing to determine what kind of cancer it is, right? Is it ductal infiltrating cancer? Is it lobular cancer? There are all kinds of cancer. That's the whole point of the pathology. The pathology is to, one, confirm that it's cancer, or say, oh, it's not cancer, it's benign. It's just a fibroad, it's just this. So if it's biopsy, this woman or this person is willing to share a CT scan and everything, she could have simply shared the pathology report and that could have cleared the air.
Exactly.
So all I can say is based on the CT abdomen, pelvis, and chest, there is no metastatic cancer. We know that to be stage 4, it has to be somewhere else, distant. And it's not in the chest, and it's not in the abdomen, and it's not in the pelvis. And the bones that were seen in the chest, abdomen, and pelvis did not show any lytic or sclerotic lesion to suggest metastasis. So the only other place left is her head, that is not in that picture, and maybe her toes. So if it's metastatic, which is very rare that breast cancer would just metastasize
to the toes,
then those are the ones we're not seeing.
Thank you so much, Dr. Oji. God bless you. Anyway, I think we have read the results. We have cleared it up. I hope we did. If not, you can type in your questions. We can always come back and do this because it's a duty. We owe it to you.
It's baffling that she hasn't had an ultrasound or mammography and we're getting CT scan looking for metastasis. So it's almost like you're gaslighting some of your followers to say, well, look at this. When the thing clearly does not show what you said.
But the followers, they don't know how to read it. So they might think, oh, she does have stage 4 cancer.